Hello all, this video is about autoimmunity and related diseases. As we have seen, the immune system is trained to differentiate between self and foreign. But sometimes it may end up in some confusion and start attacking our own healthy tissues, and then one will end up in autoimmune disease. Why this confusion starts at some point in life is not exactly known, and there are few theories to it, saying there are genetic causes or environmental factors or sometimes an infection may push one to develop autoimmune tendency. But now nothing is proven. There are again two categories of autoimmune diseases. One is the localized and the other is generalized. Localized meaning the attack is confined to one particular tissue or organ, and generalized is when multiple organs are being attacked at the same time or sequentially. Some of the localized autoimmune diseases can go on to become generalized ones. The localized diseases are much more common, and the most common ones or most popular ones are type 1 diabetes, which is diabetes which occur in children, hyper and hypothyroidism, vitiligo, which is the skin depigmentation condition. There are others also where the autoimmune attack is confined to intestine, nerves, muscles, etc. Generalized or multisystemic autoimmune disorders. Here, the autoimmune attack is against multiple tissues of the body. This group consists of various diseases, but still as a whole, these are uncommon disorders in the population, maybe 1 in 100 or much lesser. Though this seems to be advantageous, there is also a downside to it, because most of the population are not aware of a disease group like this, and it is quite difficult to make them understand when a diagnosis is made. Also, most of the doctors would not have come across these diseases in their training period, and this causes diagnosis and treatment delays. The doctors who specialize in treating these diseases are called rheumatologists. Before going to specific diseases, let me explain the nature of these diseases with an analogy. Consider a small child at home and the autoimmune tendency inside the body. So a small child will be sometimes agitated, aggressive, or maybe playful by itself or sleeping. Similarly, these diseases are sometimes full-blown in their active phase called flares, sometimes chronically progressive in a low phase, or sometimes completely inactive, which we call remission. But like the child is always there in the house, the tendency is always there in the body.